This educational video will help patients and caregivers understand and manage eczema. The main goal of eczema care is to maintain healthy skin. Just as you brush your teeth twice a day to maintain good oral health, you also need to take care of your skin every day to keep your eczema under control and to maintain your skin barrier. What is eczema?
Eczema is a chronic inflammatory skin condition characterized by dry plaques that are red and severely itchy. The symptoms can be mild, where the skin looks dry and scaly, or they can be more severe, where the skin becomes red, raised and raw, with oozing, crusting and scaling. And although there is no cure for this skin condition, it can be managed by being consistent and diligent with your daily skin care. Eczema can occur anywhere on the body and is usually found on the flexors, on the back of the arms, back of the knees. There are many types of eczema, but the most common one is atopic dermatitis. Atopic refers to the hereditary tendency towards eczema, asthma and allergies. People with eczema may also suffer from one of these other atopic diseases.
What causes eczema?
The exact cause of eczema is unknown. However, research has shown that there are genetic, immunological, and environmental factors that play a role. Eczema can come and go and can move around the body. Just as one plaque clears up, another one may develop. This is the chronic nature of the disease. The skin is made up of two main layers, the outer layer called the epidermis and the inner layer called the dermis. The epidermis is the skin's barrier. Our skin is the barrier to the outside world. It is somewhat waterproof and keeps our internal organs and systems safe from the elements and from bacteria that may try to invade our bodies. Healthy skin is like bricks and mortar. The skin oils which act like mortar hold together the skin cells which are like the bricks, creating a nice strong barrier. Atopic dermatitis patients, however, have an impaired barrier. That means that their skin barrier is broken down, letting their natural moisture out and allowing irritants and allergens in. This causes their skin to become dry and crack, and when this happens, it is known as an eczema flare-up.
For people with eczema, their oil or mortar is broken down, causing cracks and damage in their skin barrier. Therefore, the goal of eczema management is to get moisture back into the skin and to create a barrier to protect the skin and eventually improve the patient's own skin barrier function. Flare-ups.
Flare-ups can be caused by environmental irritants or triggers, such as certain soaps, laundry detergents, clothing fabrics, deodorants, perfumes, carpet fibers, and dust. Sometimes a flare-up will occur with no recognizable trigger. Overheating, excessive sweating, low humidity, certain foods, anxiety, and stress can also contribute to these flare-ups. When the skin becomes irritated by one of these triggers, it itches, causing the sufferers to scratch the affected area. Scratching makes the condition worse, and the skin becomes inflamed and reddened, further aggravating the itch. This is called the so-called itch-scratch cycle, and it can become so severe, causing tremendous pain. One thing I'd like to emphasize to both adult patients and the parents of children with eczema is that it is most often a chronic condition. There is no magic bullet, no cure. However, you can effectively manage this condition, but it takes daily diligence and continued efforts.
Bathing and moisturizing.
Frequent bathing, even 2 to 3 times daily, followed by a moisturizer, should be your first defense in managing eczema and their flares. Bathing allows moisture to enter the skin, and coating the skin after every bath or shower with an emollient or moisturizer helps to seal that moisture into the skin. This is necessary for patients with eczema as their natural skin barrier, which would normally trap moisture in the skin, doesn't work very well. As a result, this leaves their skin dry, rough, and sensitive to irritants. In the past, some patients were told not to bathe daily. However, today we know that it is the bathing and moisturizing technique that actually helps to hydrate the skin and improve the eczema. To keep your skin well hydrated, take a 5 to 10 minute bath or shower in warm but not hot water. After getting out, pat the excessive water off your skin using a soft, clean towel, but leave some of the water on your skin. Then apply your moisturizer within 3 minutes of your bath or shower. It is important to apply the moisturizer on your skin while it is still damp, because this is what helps to trap some of that water into the skin, keeping it healthy and moist. Also remember to apply a moisturizer several times throughout the day. Moist skin will reduce itchiness, which in turn results in less inflammation, reducing the itch-scratch cycle.
Choosing products.
When you have eczema, choosing the right product to put on your skin becomes extremely important. You will need a gentle moisturizer, a gentle cleanser, and both of these together can actually help. Soap actually dries the skin, so choose a gentle skin cleanser that is formulated for eczema or one that is made for sensitive skin. Also select a moisturizer that is formulated for eczema and one that feels good on your skin. By remembering to moisturize every day, you will greatly reduce the drying and cracking of your skin. This therapy will keep your eczema under control and manageable. With a little bit of effort, your skin will be the best it can be, and in return, you will be the best you can be.
Seal of acceptance.
The Eczema Society of Canada is a registered Canadian charity dedicated to education, support, awareness, and research. Eczema is most often a chronic condition, and people living with eczema have to care for their skin every day in order to control the eczema. Diligent daily skin care, along with the avoidance of triggers, is what helps to improve the skin. The most common question that we are asked is related to skincare products, such as what cleanser is gentle enough and what moisturizer should I be using. This inspired our Seal of Acceptance program, whereby we review products using a strict criteria. Our expert panel looks at ingredients, formulation, and clinical data to ensure that those products are gentle and effective. A number of products have earned our seal and are all good choices for your daily eczema regimen and to care for your sensitive skin.
Treating inflammation.
Inflammation within the skin is the cause of eczema flares. Prescription treatments target that inflammation and help to clear the skin. There are 4 main groups of prescription products: topical corticosteroids such as hydrocortisone or betamethasone valerate, topical immunomodulators such as Elidel or Protopic, antibiotics such as Fustin and Fustin H or oral antibiotics, and also barrier repair emulsions such as Episerum.
Topical corticosteroids.
Topical corticosteroids are prescribed to reduce inflammation and itching, with strengths ranging from mild to very strong. Often eczema sufferers or their caregivers do not use this treatment properly. They either use it too sparingly or not frequently enough because they are afraid of the potential side effects. However, by following your physician's specific directions and advice, topical corticosteroids are safe treatment options. Typically, you would apply this treatment after a bath to towel-dried skin and only to the plaques of eczema that you would apply your regular moisture to the rest of the skin, and then to the eczema plaques at another time throughout the day. Remember to ask your doctor questions if you're unsure about how to use this treatment or if you have any concerns while using it.
Topical immunomodulators.
Topical immunomodulators such as Elidel and Protopic are very helpful in managing a patient's inflammation and itching and will extend the length of time between flares. These products should be applied to skin that is dry and only to the areas affected by eczema. A possible side effect is a mild to moderate burning sensation, and it should be noted that these treatments are not recommended for children under the age of 2. We recommend that you speak to your doctor if you experience any discomfort or side effects.
Topical antibiotics.
Topical antibiotics are prescribed for secondary infections. Bacterial infections on the skin makes the eczema worse and harder to heal. Your doctor may prescribe Fustin H, which is a topical corticosteroid mixed with fusidic acid, which will help to clear the infection. You would apply this treatment after a bath to towel-dried skin and only to the areas affected by the eczema. You would then use your regular moisturizer on the rest of the skin. You may also use this more than once a day, but it's important that you speak to your doctor first and that you use this treatment option exactly as prescribed. If the infection is more widespread or more serious, your doctor will prescribe oral antibiotics.
Barrier repair emulsion treatments.
Episerum is a new, non-steroidal barrier repair emulsion therapy that is safe for all ages. Episerum is made up of key lipids or fats that are said to be lacking in the skin of many patients with atopic dermatitis or eczema. When compared head-to-head with a mild potency topical corticosteroid, it was shown to have similar benefits in improving eczema. Apply this treatment to your skin after bathing and then gently pat your skin with a soft, clean towel. You may also apply it additional times throughout the day, but always speak to your doctor first to ensure that it is the most suitable course of treatment.
Tips for living with eczema.
In addition to bathing and moisturizing and using your prescription products, there are a few other things that you can do to stay comfortable and effectively manage your eczema throughout the day. As the Executive Director of the Eczema Society of Canada, I also have 2 children who suffer from the condition. To help us manage on a daily basis, I like to keep the following tips in mind. First, there's no quick fix to eczema. It takes long-term management, but if you put in the effort, you should see great results. Keeping your skin moist and well hydrated by bathing and moisturizing daily is your first line of defense. A cool mist humidifier may be helpful, especially in the bedroom. Just ensure that you follow the cleaning instructions that come with the unit. Avoid sweating and overheating when possible, as it will increase the itchiness and contribute to your eczema flares. Try applying an ice pack to the skin during an itchy flare-up, as this will help to ease the itchiness and the discomfort. Be sure to use some type of layer of cotton or a towel between your skin and the ice pack just to protect the skin. Cotton breathable clothing is often most comfortable against the skin. Arm yourself with a good moisturizer and a gentle cleanser. And do apply that moisturizer a few times throughout the day or when you start to feel a little bit itchy. Avoid harsh soaps, detergents, and fragrances, as these may contribute to your eczema flares. Look for sunscreens that are formulated for sensitive skin, and it's often wise to patch test these on a very small area before applying to the entire body. Keep nails filed short and smooth to lessen the damage done by scratching. This is especially important for children because the damage that they do is what contributes to eczema flares and to possibly infection. Use your prescription products exactly as your doctor tells you and ask questions when you're there if you're unsure or have any concerns about your treatment. Remember that people often use too little of a product rather than too much, and using the product correctly is going to ensure that you get the results you're looking for.